Hello and welcome to the AHP Support Worker Framework video presentation. My name is Kieran Dalton and I am the AHP Supply Support Worker Lead for the Norfolk Waveney ICS. I am also an Integrated Therapy Assistant at the Norfolk Norwich Hospital. Today I'm going to be talking about what the framework actually is, what the aims of the framework are, and what the framework is going to mean for our different staff members as we begin to implement it across the ICS. So Health Education England has published the AHP Supply Support Worker Framework to maximise the contribution of the AHP support worker workforce to deliver safe and effective care. It's going to be focusing on the support worker competencies, education opportunities and career development for our support workers within the services. So, looking at the aims of the framework, we will be looking at ensuring patients or service users have access to skilled and consistently trained support workers who have a defined role within their team, service and organisation. Support workers having access to development structures that provide opportunities for rewarding career paths. Services addressing current variation in support worker roles, banding and progression opportunities, and the support workers being included and helping lead in service improvements, transformations and the new models of care. It is acknowledged that each profession within the AHP services will vary and that the framework should be used alongside profession-specific standards. Why are we implementing the framework? Well, the framework allows employees, networks and the ICS to effectively plan, develop and deploy support workers in AHP services, looking to improve in the following areas: recruitment and retention, encouraging people to join at different support work levels depending on their current skill set, experience and qualifications, and giving them a reason to want to continue to work in and progress through the service. Also education and encouraging a grow your own mentality within the service, allowing support workers from Band 2 level onwards equal opportunities for development through the service, as well as looking at supporting education providers to provide and deliver education programs. And finally, training and giving a clear scope of practice to make sure that support workers and their qualified colleagues have a clear understanding of the roles and responsibilities expected of support workers across all bandings. What does this mean for our professional and clinical staff? It ensures all team members are clear about roles and boundaries to support safe and appropriate delegation of tasks and responsibilities. It will facilitate better team working through a competency-based skill mix. It will support supervision and personal development planning, and it fully supporting the learning and development of our support worker colleagues. And of course, what does this mean for our support workers themselves? Well, it identifies where opportunities are for staff who want to develop further. It supports regular supervisions, appraisals and CPD opportunities. It offers opportunities for staff to progress through to qualified roles through apprenticeships, if this is where they wish to take their career. And it ensures that staff are being utilised appropriately according to their knowledge and skill base, while also making sure that support workers aren't being asked to work under or beyond their scope of practice. Here we have the AHP framework stages, starting with entry level, where the minimal education and competency requirements for all support workers working AHP services lie. At this stage, support workers will use general skills and work under the supervision of registered staff. Next, we have the intermediate or senior support worker level. Here they will use more advanced skills under the supervision of registered staff and may also work alone in certain areas while still having access to their registered colleagues if needed. Responsibilities may include the direct delivery of clinical, technical or scientific activities following their appropriate training. They may also demonstrate their duties to other support workers, students or less experienced staff. And they will contribute to service improvement and be able to make fact-based judgments. It is possible for support staff with relevant qualifications and wider experience to enter this stage of the framework. And then the next stage we have the assistant practitioner role. Here, support workers will work at a level above that of their healthcare support workers and have more in-depth education and understanding about factors that may influence health and ill health. For example, knowledge of anatomy and physiology. Support workers at this level would possess enhanced skills in their area of work, which may be a specialist clinical area. They will provide routine and non-routine care and support, including the service user with more complex needs and making assessments of their intervention progress. Here we have the different framework domains that look at the specific different areas that the framework will be mapping out. We will be asking service and team leads to be working with their support workers to record the current banding level, knowledge base and qualifications based through 8 different domains. These domains are formal knowledge and experience, supporting service users and their family members, clinical, technical and scientific roles and responsibilities, communication and information, safe and inclusive environments, research and service improvement, leadership, and the personal and professional values and behaviours. And you can see further information on these domains in the diagram in the slide. What are the next steps then? We will be explaining the framework to staff, both seniors and supervisors, as well as support workers. Trained seniors will be asked to complete the education qualification mapping tool with every AHP support worker. We will be storing a profession-specific copy with service managers, and that information will be returned to AHP Workforce Supply Lead, where they can collate that information and feed it back so it can be used for future new starters within the service, as well as any current support workers who may be looking to develop further. If you have any questions or you would like to know more, please get in contact with the AHP Workforce Supply Lead within your organisation. Thank you for listening to the presentation today, and we look forward to hearing from you very soon.